Please be seated. Thank you all. Please be seated. Good afternoon, and thank you all for coming. On September the 11th, the world learned how evil men can use airplanes as weapons of terror. Shortly thereafter, we learned how evil people can use microscopic spores as weapons of terror. Bioterrorism is a real threat to our country. It's a threat to every nation that loves freedom. Terrorist groups seek biological weapons. We know some rogue states already have them. It's important that we confront these real threats to our country and prepare for future emergencies. Protecting our citizens against bioterrorism is an urgent duty of American governments. We must develop the learning, the technology, and the healthcare delivery systems that will allow us to respond to attacks with state-of-the-art medical care throughout our entire country. Biological weapons are potentially the most dangerous weapons in the world. Last fall's anthrax attacks were an incredible tragedy to a lot of people in America. And it's a warning that we needed and have heeded. We must be better prepared to prevent, identify, and respond. And this bill I'm signing today will help a lot in this essential effort. First, the bill will enhance our ability to prevent and detect bioterrorist attacks. We must and we will improve inspections of food entering our ports and give officials better tools to contain attacks on our food supply. We'll have new authority to track biological materials anywhere in the United States. Second, the bill will strengthen the communications networks that link our healthcare providers with public health authorities. Biological attacks can be carried out quietly. Our healthcare professionals are likely to be the first to recognize that there has been an attack. The speed with which they detect and respond to a threat to public health can be the difference between containment and catastrophe. Thirdly, the bill will strengthen the ability of our healthcare system to expedite treatments across our country. It will provide our state and local health authorities with resources and tools needed to do their job. And this bill will further develop stockpiles of smallpox vaccines. Finally, the bill will help us develop better medicines for the future. It reauthorizes and improves the Prescription Drug User-Free Act. This will make new life-saving drugs and therapies available more quickly and will help ensure the safety and effectiveness of the treatments. We'll also be able to use the combined research expertise of the government and the private sector to improve our vaccines, our medicines, and our diagnostic tests. Strengthening our protections against bioterror is a part of a larger effort to deal with the new threats of the 21st century. If we're going to succeed, we need to reorganize our government. And that's why I look forward to working with Congress to create the Department of Homeland Security, to make sure we align authority and responsibility, to make sure that we have an effective response to the enemy that still wants to hit America. This bill today I signed is a part of the process of doing our duty to protect innocent Americans from an enemy that hates America. I'm proud to sign the bill, and I'm proud to welcome the bill sponsors here to the Rose Garden. Thank you all very much.